In the last chapter, we gained an overview of the role of IMCI procedures in managing our patients in the health centre. Now we'll be more specific, looking at the common complaint of cough and difficult breathing. Following the IMCI guidelines will lead to a successful outcome for most patients. Respiratory infections can occur in any part of the respiratory tract, such as the nose, throat, larynx, trachea, air passages, or lungs. A child with cough or difficult breathing may have pneumonia or another severe respiratory infection. Pneumonia is an infection of the lungs. Both bacteria and viruses can cause pneumonia. In developing countries, pneumonia is often due to bacteria. The most common are Streptococcus pneumoniae and Haemophilus influenzae type B. Children with bacterial pneumonia may die from hypoxia, too little oxygen, or sepsis, generalized infection. There are many children who come to the clinic with less serious respiratory infections. Most children with cough or difficult breathing have only a mild infection. For example, a child who has a cold may cough because nasal discharge drips down the back of the throat. Or the child may have a viral infection of the bronchi called bronchitis. These children are not seriously ill. They do not need treatment with antibiotics. Their families can treat them at home. Health workers need to identify the few very sick children with cough or difficult breathing who need treatment with antibiotics. Fortunately, health workers can identify almost all cases of pneumonia by checking for only two clinical signs: fast breathing and chest indrawing. When children develop pneumonia, their lungs become stiff. One of the body's responses to stiff lungs and hypoxia, or too little oxygen, is fast breathing. The cutoff for fast breathing depends on the child's age. Normal breathing rates are higher in children aged 2 months up to 12 months than in children aged 12 months up to 5 years. For this reason, the cutoff for identifying fast breathing is higher in children 2 months up to 12 months than in children 12 months up to 5 years. The child who is exactly 12 months old has fast breathing if you count 40 breaths per minute or more. When pneumonia becomes more severe, the lungs become even stiffer. Chest indrawing may develop. Chest indrawing is a sign of severe pneumonia. To see if a child has chest indrawing, the health worker must lift or ask the mother to lift the child's shirt. The health worker looks for chest indrawing when the child breathes in. He looks at the lower chest wall, the lower ribs. The child has chest indrawing if the lower chest wall goes in when the child breathes in. Chest indrawing occurs when the effort the child needs to breathe is much greater than normal. In normal breathing, the whole chest wall, upper and lower, and the abdomen move out when the child breathes in. When chest indrawing is present, the lower chest wall goes in when the child breathes in. If the health worker is not sure that chest indrawing is present, he should look again. If the child's body is bent at the waist, it's hard to see the lower chest wall move. The health worker should ask the mother to change the child's position so he's lying flat in her lap. If the health worker still doesn't see the lower chest wall go in when the child breathes in, the child does not have chest indrawing. For chest indrawing to be present, it must be clearly visible and present all the time. If the health worker only sees chest indrawing when the child is crying or feeding, the child does not have chest indrawing. Signs of illness and their classifications are listed on the Assess and Classify chart in the classification tables. Most classification tables have 3 rows. If the chart is in colour, each row is coloured pink, yellow or green. The colour of the rows tells the health worker quickly if the child has a serious illness. The health worker can also quickly choose the appropriate treatment. A classification in the pink row needs urgent attention and referral or admission for inpatient care. This is a severe classification. A classification in the yellow row means that the child needs an appropriate antibiotic, an oral antimalarial, or other treatment. The treatment includes teaching the mother how to give the oral drugs or to treat local infections at home. The health worker advises her about caring for the child at home and when she should return. A classification in a green row means the child does not need specific medical treatment such as antibiotics. The health worker teaches the mother how to care for her child at home. For example, the health worker might advise her on feeding her sick child or giving fluid for diarrhea. Depending on the combination of the child's signs and symptoms, the child is classified in either the pink, yellow or green row. That is, the child is classified only once in each classification table. There are 3 possible classifications for a child with cough or difficult breathing. They are severe pneumonia or very severe disease, pneumonia, or no pneumonia, cough or cold.